Waiting can be frustrating for patients, but an unorganised appointment system can have worse consequences for staff and clinicians. Now, swiftQueue is streamlining healthcare appointments with online connectivity and improved patient flow for each and every appointment. And here's how the system is working on the NHS's front line.
This is Basildon Hospital's phlebotomy clinic. It's run by Pathology First for Basildon and Southend NHS trusts. The signs tell us that we're in a waiting room.
Next patient, please.
But the empty chairs reveal people don't have to wait too long for an appointment.
Next patient, please.
There's a reason for all of this, and no, the outpatient phlebotomy department isn't closed. They've introduced a new online queuing system that means patients are now more in control of their appointments.
So the system before the online booking system was a walk-in service for patients. We would sometimes have over 100 patients here during the day. It was very disorganised, and because it was a walk-in service, we could never anticipate how many patients were going to walk in any given time.
The system's success is rooted in its simplicity. Patients are able to log in and book appointments online, or, if they choose, via call centres and e-referral channels. They're able to see appointment spaces in real time. And crucially, the team at the hospital can see all of this information too. This means they can control and deploy resources, seamlessly delivering an improved patient flow across all clinics.
These are the feedback forms that the patients fill in when they come in for a blood test. Previously with the old system, they used to be quite negative. Since the booking system's come into place, they've been really, really positive. Patients saying it's a fantastic new system. They didn't have to wait for more than 30 seconds before they were called. Wonderful appointment system.
It's so much easier. You can book it online at home, then you come in, you punch it through into the system, and then because you've got an appointment, you just sit in here, you wait for your appointment and you go straight in. It's so much easier and so much quicker.
Brendan Casey is the CEO of swiftQueue. He's keen to stress that swiftQueue deliver improved communication, a better experience for all patients and a more efficient patient flow for the clinic. This is all supported by real-time reporting.
So we're able to then feed into the third pillar, which is the real-time dashboards for the clinics, so that they can understand how well they're operating or where there are areas that need to be addressed in terms of measuring their efficiencies, and real-time stats, not just for one clinic, but for many clinics throughout the hospital or throughout the NHS Trust.
This extra information enables staff to work more efficiently and ensures patients have as much information as possible.
The system is available 24/7, so patients can book in time that's convenient to themselves. Information when they do book in, they get text back to confirm that their booking has been taken through, so they're getting information there and a reminder, so that's really helpful. And we're hoping that that's going to reduce the number of DNAs in the future.
The other benefits are that when they book an appointment, we can provide them with information about the most appropriate location to come to be bled. We can advise them to not eat in advance of a blood test, and we can direct certain patients to clinics where they'd be best seen.
Could this then spell the end of a famous British pastime? swiftQueue are currently implementing their solutions in several other NHS trusts. They're expanding into new areas and specialities too, including outpatient clinics, physiotherapy, endoscopy and radiology. Queuing in hospital could soon become a thing of the past.